this lesson, we will do laying on your front side. And if you know that's uncomfortable to you in any way, then you could have some sort of blanket across your chest or your abdomen. If you can be on a surface that you can slide on, that's ideal. And so get what you need for that, and then put that off to the side. And when you're ready, come and stand up. And see what you notice about yourself in standing. Is there any part of yourself that you feel is using effort to keep you upright? And notice when you're standing, do you find that you have more of a sense of the front of you or the back of you? And then how about your breathing? Is that something that you experience more in the front of you or the back of you? Is there anywhere that you get a sense of breathing in the front of you and the back of you simultaneously? Is there any part of you that could be a little bit more comfortable in standing? Take a little walk around your space slowly. And now that you are moving, what changes about the way that you see yourself? The way you experience the front and the back of you, the way you experience your breathing. And remind yourself that there's no right answers, there's no problems to solve. You are engaging in a process of observing and learning to sense differences with a little bit more clarity. So leave that and come lay down on your back on the floor. Bring your legs down long and bring your arms by your sides. If that is not a comfortable position for you, then keep your knees bent and your feet standing. And once you get there, give yourself a little time to settle in. If your legs are long, you are very much in the same configuration as when you were standing. And yet your nervous system has a very different job to do when you're standing from when you're laying down. So notice in this orientation of gravity, what's different from when you were standing up. One thing that might be different is the consistency along the back of you. Now your heels and the back of your legs and the back of your pelvis and your back and your head are all more or less in the same plane, as are your arms. So you might consider how that was different when you were standing. And then the place or the places that you notice effort in standing, have they changed? Now that those parts of you, that part of you has potentially different job to do. And what's different about your breathing now that you're laying on your back? Is there any part of you that you feel your breath simultaneously in the back of you and in the front of you? And how about the sides of you? Do you find that there are places along the sides of you that are clearer to sense your breathing now that you're resting on your back? And could you stay with yourself for just another couple moments and notice if there's anything that you're holding on to, sort of vigilance, that you could soften your grip on? Mental preparing or physiological preparing. Could you let yourself drop a little bit deeper into the floor and into a quiet sense of yourself? And can you maintain the quiet sense of yourself even as you start to do movements and change your position, even if there's an instruction that maybe you don't fully understand? See if you can continue to observe yourself from this place of relaxed quiet. Now do a movement of rolling your head a little bit, left and right. And see what you find there. Is it more comfortable turning in one direction? And then leave your head quiet, and maybe we could call it rolling your shoulders. Similarly, lift one of your shoulders slightly away from the floor and pay attention to the other one. And then bring that one down. So you would lift your right shoulder slightly from the floor and feel your left shoulder. Bring it down, and then lift your left shoulder slightly from the floor and feel your right shoulder. And I direct you to pay attention to the opposite shoulder so that you can think about the lifting movement as something that involves more than just the thing that's lifting. Are there other parts of yourself that are involved? Is there any response in your neck, in your eyes? Any response going down your back to your pelvis, just from this very slow, very gentle alternating of lifting one shoulder, bringing it down, lifting the other shoulder, bringing it down, very slowly, very slowly. Then leave your shoulders quiet, and if your legs are long, continue to leave them long. And see what happens if you try to do a similar movement with your pelvis, so that the left side of your pelvis shifts slightly away from the floor. And you might find that the right side of your pelvis shifts slightly deeper into the floor. You might find you can't do a movement like that. That's not something you can do. Or you might find you can do it, but it takes a lot of effort. You have to squeeze in your buttocks, or you have to squeeze in your back. is there a effortless way to roll your pelvis when your legs are straight? And at this point, you might say no. Leave your pelvis quiet and keep your feet resting, but do a movement like that with your feet so that your 2 feet will look a bit to the right and the pressure will change along your heels. And then your 2 feet will look to the left and the pressure will be a little bit more on the left side of your heels, and see what that's like. Does the movement of your feet speak to any other part of yourself? Do you notice any preferences you have in your organization for turning your foot inward or outward? Any differences between the right and the left foot? And then leave that and roll onto your front side. Bring your arms up to frame your head, your hands maybe a little bit above your head, maybe the sides, whatever is comfortable. And notice how you've placed your head. Which cheek did you choose to rest your face on? And make a note of your first choice. And then switch so that you're looking the other way. And see what kind of differences you can notice, specific differences. So for example, maybe now you're resting on a different part of your face. Maybe it's a different part of your chest. Yeah, now do a little bit of research on your own, and you could return to your first preference and see what sort of differences you can sense in other places. Does anything change about your shoulders? Which armpit is closer to the floor when your face is facing to the right? And then which armpit's closer to the floor when your face is facing to the left? Notice when you turn your head, do you reach your chin forward or do you tuck your chin down? Do you have a preference there? And what do you notice about your shoulder blades? Does one of your shoulder blades move in a particular way when your face is facing the right? As opposed to when your face is facing the left? And again, it can be really hard to feel. That's what this is all about. So don't get frustrated with what you cannot feel, just notice what you can feel. And get curious about the areas that are not so clear, that you can improve your awareness of. And then go back to your right cheek on the floor. And if that's terribly uncomfortable for you, you can keep your left cheek on the floor, and it's just up to you to reverse my instructions. It would be too difficult for me to verbally accommodate your unique choices, okay? So your right, what did I just say? Right now, your right cheek is on the floor. Is that what I meant to do? Yes. Your right cheek is on the floor. And now see if you can do a movement of your right shoulder blade. Could your right shoulder blade slide a little bit toward your spine and away from your spine?
Can you repeat that?
Mm-hmm. So your right cheek is on the floor and your hands are somewhere above your head or near your head. And you want to see if you can do a movement of your right shoulder blade, right scapula, so that it slides closer to your spine and then further away from your spine. And see if you can make the movement simpler and smaller and slower. So that it's not a movement of your whole arm at this point, it's just a movement of your shoulder blade. And if you can really dial it down and get into that deeper subtlety, you might start to notice a correlation to how your face is resting on the floor. When your shoulder blade slides closer to your spine, do you feel more or less of your face on the floor? And then compare that to the left shoulder blade. So leave your right shoulder blade quiet and start to slide your left shoulder blade, not the whole arm, not the hand, just the shoulder blade, which again, at first could be like, oh, I don't know how to do that. And then so it's interesting. And you see, well, what can I do? What does she mean sliding the shoulder blade toward the spine? Is there anything you can change to make that more accessible for you? And if you feel some kind of movement of your shoulder blade, maybe you're not sure if it's toward your spine or not, but sense, does that have any influence on the position of your head, the way that your face is resting on the floor? And when your shoulder blade slides closer to your spine, do you feel like you have more or less space between your armpit and the floor? Your shoulder blade slides toward your spine. Is there more or less space between your armpit and the floor? Leave the left shoulder blade quiet and again try with the right shoulder blade. See if that's getting any clearer. And if you can listen to the relationship between movement of your shoulder blade and the position of your head. And on this side, when your shoulder blade's closer to your spine, does this armpit feel like it gets closer or farther from the floor? And then rest your brain for a moment. If you want to change the position of your head, do so. And then have your left cheek on the floor, the one that wasn't just on the floor. And do a little bit of the same kind of research. Notice what sort of movement you feel in your right shoulder blade. And if you can get a sense of your armpit on the right. Your armpit is the outer corner of your chest. And does it influence the position of your head? In other words, does it make your head more comfortable, your neck more comfortable, or less comfortable, depending on if your shoulder blade is closer to your spine or farther from your spine? Does it make any difference in the comfort of your neck? And then try that with your left shoulder blade. So your left cheek's on the floor, and you see when you move your left shoulder blade in toward your midline and back, is there any coordination there that makes your neck more or less comfortable? And then leave that and go back to whatever your first preference was when you first lay down and you put one cheek down. Maybe it's this one that's down already. And then do a little bit of comparison again of the feeling of each side of your face on the floor. And if now you're starting to get more of a sense of a relationship to the position of your shoulders or your chest relative to your neck and your head. So often when we have a pain in the neck, or we think we have a problem with our neck turning our head, or we hurt it, we say, oh, my pillow was bad when I was sleeping, I did something weird in my neck. It could be useful to also investigate how you're using your shoulders. And it might not actually have anything to do directly to your neck so much as the relationship of your shoulders to your back. Okay, so now go back to having your right cheek down on the floor, if you're not there already. And now do a movement of rolling your pelvis to the left and to the right, and see if you can determine what your preference is. Which coordination feels more comfortable for you? See that your legs are at least hip width apart, your feet are at least hip width apart. And go slowly. Go slowly so that we can do a much more advanced study here. You can really get into more nuances that aren't necessarily what you are used to paying attention to. And when you're rolling your pelvis, do you find that you lift the front of your pelvis away from the floor? Do you press it into the floor? How do you roll your pelvis? How do you even do that? Can you be aware of the front of yourself and the back of yourself simultaneously? It looks like several of you are using significantly more effort than you need to be. So go back into that quiet, relaxed place and see if you can be okay with almost doing nothing at all. Okay, and then change the position of your face again. So your left cheek is down on the floor. And feel what it's like to roll your pelvis gently, slowly to the right and come back, or to the left and back. And do you have a preference here? You might find that in one direction it just seems to make sense more, seems easier or more accessible. And as you're feeling the movement of your pelvis, what do you notice about your feet? And start to just roll your pelvis to your left and come back. And notice your right heel. Your left cheek is on the floor. You're rolling your pelvis to your left and coming back. And you're paying attention to your right heel. Does your right heel turn a little bit to the right or to the left with your pelvis? Now, if you're integrating your heel and your pelvis, what do you notice about your shoulders, your shoulder blades and your armpits? Does one of your armpits feel like it gets closer to the floor? And then change the position of your head once again, so your right cheek's down. And roll your pelvis to the right and come back. And notice your left heel. When you roll your pelvis to the right, turn your left heel a little bit to the right also. Do you feel any kind of movement in your shoulder blades? And let that go and roll over onto your back. And feel the kind of contact that you're making with the floor. And listen for any little differences, any little changes in your perception, changes in your sensation, changes in your overall feeling. Come back onto your front side. Put whichever cheek down that was your first preference. Maybe is still your preference, maybe isn't your preference anymore. And reinvestigate the feeling of turning your head and placing the other cheek on the floor. And notice how you do that. And what parts of yourself are becoming involved in the movement of turning your head. Can you start to get a sense of what's different when you're in your preferred position? Is there something different about your shoulders, something different about your back, your chest? Okay. Now leave your right cheek down again. And start to do a movement of lengthening your right arm. And then returning. So your right hand slides along the floor above your head. You can imagine that you're reaching for something on the floor just above your head or to the side of your head. It doesn't need to be directly above your head, but you're reaching your arm forward of yourself. And again, if you do the movement slow enough and careful enough, you might start to get a sense of what you do with your right shoulder blade. Does your shoulder blade get closer to your spine or does it get farther from your spine? Does it get closer to your head or farther from your head? And what about your pelvis? When you're reaching your right arm, what do you do with your pelvis? Do you roll your pelvis to the left when you reach your right arm? Do you roll your pelvis to the right when you reach your right arm? Or do you feel like your pelvis actually doesn't move? And do some research there and see which rolling of the pelvis makes more sense to you. When you reach your right arm, does it feel like you're able to reach your arm easier, farther, more comfortably if you roll your pelvis to the right or if you roll your pelvis to the left? And then just roll your pelvis to the right as you're reaching your right arm. And if you happen to be a swimmer, this movement might remind you of a freestyle or a front crawl. Okay, and then take a little rest on your front, however you like. And then put your left cheek down. And start to lengthen your left arm along the floor, above your head. And see, when you're lengthening your left arm, what's your preference? Rolling your pelvis to the right or to the left? What do you notice about the way your face is touching the floor? And then continue to just roll your pelvis to the left as you're reaching your left arm. And notice if your heels are responding to your pelvis. And if they're not, see if your heels can also look a little bit to the left as you roll your pelvis to the left. And then rest as long as you need. And when you're ready to keep exploring, you're going to see what it feels like to alternate, reaching your right arm when your right cheek is on the floor. So you're reaching the arm that's behind your head and you're rolling your pelvis in that same direction. And then you're changing the position of your head, reaching the arm behind your head and rolling the pelvis that direction. So when your left cheek's on the floor, you reach your left arm and roll your pelvis to the left. And then you switch so that your right cheek's on the floor and you reach your right arm and you roll your pelvis to the right. And of course, if you were swimming, front crawl, or freestyle or whatever, the arm that was in front of you would be the bent arm. You'd be paddling with the straight arm. It need not be a dramatic movement. And in fact, you might find that you get a little bit more out of it if you reduce the size of the movement. And then roll onto your back and take a rest. And feel your back on your neck, and your shoulders and your pelvis. And notice the kind of contact that the back of your legs are making with the floor. See if what you've done so far has had any kind of influence on the way that you feel you're breathing, in the sense of the front of you and the back of you. And then once again, come onto your front side. Put whichever cheek down is more comfortable. And have your arms in that little diamond sort of shape. Your elbows are bent, your hands are somewhere above your head. Notice how this position feels for you. And then if your right cheek isn't on the floor, put your right cheek on the floor again. And now this time, roll your pelvis to the right and come back a couple of times. And notice your left knee. And feel how your left knee is probably starting to bend a little bit as you continue rolling your pelvis to the right. And then start to increase the bend of your left knee, but not too much. And feel as you're rolling your pelvis to the right and letting your left knee bend up a bit, what do you notice about your elbows? Which elbow goes down? And which elbow goes up? Down in the direction of your feet. And just check and see, is that the same if you roll your pelvis to the left? And then put your left cheek down on the floor. Roll your pelvis to the left, let your right knee bend. And try to reduce your effort. Try to keep track of yourself so that you don't practice moving the way that you're most habituated to moving in, but you give yourself an opportunity to use more of yourself, right? If you're doing a quick or a strong movement, it's almost inevitable you'll first just do it the way you always do it, right? And then when you're rolling your pelvis to the left and you're bending your right knee, which elbow goes down? Now, when you're rolling your pelvis to the left and you're bending your right knee, try to slightly bring your left elbow down. And feel that organization. Just slightly. Your hand stays where it is. It's just a little pull down on your left elbow. Pelvis rolls to the left and a slight pull down on your left elbow. And how is that different from when your pelvis rolls to the left and there's a slight pull down on your right elbow? Okay, and then give yourself a rest on your front as you are. You can change your head if you like. And then put your right cheek down. Lengthen your right arm a little bit. And a few times as you're lengthening your right arm, roll your pelvis to the right. Your right cheek's down. You're lengthening your right arm. You're straightening your right arm. And then compare that to if you roll your pelvis to the right, but you slightly bend your right arm. You're still rolling your pelvis the same way, you still have the right side of your face on the floor. Now, instead of stretching or reaching your right arm, you're bending your right arm along the floor. How is that different from when you're reaching your right arm along the floor? And then pause and put your left cheek on the floor. Lengthen your left arm a little bit. So your right arm stays bent in front of your face and your left arm, the one that's behind you, is straight. Now this time, dial it all down considerably, okay? And as you're rolling your pelvis to the left, lengthen your left arm and see, does your left armpit get closer to the floor or farther from the floor? What is the effect of coordinating the rolling of your pelvis with the lengthening of your arm? What's the effect on the left side of your chest? And now try rolling your pelvis to the right as you're lengthening your left arm. And if there was something very, very important that was just out of reach of your left fingertips, what kind of influence would this movement of your pelvis have on your ability to reach what you wanted? And compare it to the original coordination of rolling your pelvis to the left as you lengthen your left arm. And then leave it and roll onto your back. And lengthen yourself out so you can again get a sense of the particular way that you're making contact with the floor now. The distance that you feel between your 2 feet relative to the feeling of the back of your pelvis, relative to your upper back and your shoulder blades. And what's it like now to roll your head left and right? What's it like now to lift one shoulder and drop the other one? Roll your shoulders a bit left and right. What's it like now to roll your pelvis a little bit left and right? And then leave that and notice how you're breathing. And I think in this lesson, for many of you, the proof is in the pudding. And I think that it might be very interesting to you to see what you feel like once you are standing up and walking around again. But for now, continue to rest as long as you feel like you need. And I will leave you to do so. And then when you're ready, you'll get up and walk around. And thanks for coming. See you soon.